Hey guys, welcome back to the Movement Project. So it's episode 40. Today we're going to talk about shoulder impingement. So that commonly happens to athletes that are doing a lot of overhead lifting and athletes that are doing a lot of overhead throwing or movements like swimming. So what we're going to do is kind of talk about it real quick. So this is Casey's scapula. All right, it's kind of got this little L shape. And what happens is a lot of times this structure gets kind of glued to the rib cage. This is your AC joint. This is your humeral head right here, located here. And what happens is without a lot of movement here, because this is glued, and with constant overhead pressing and internal rotation of the shoulder, she'll reach overhead, and that glenohumeral joint will actually kind of pinch. The bones will come together. Instead of having that nice glide between the shoulder, the humerus, and the shoulder joint, it'll actually come and pinch into the tissues and the nerves right there in the joint. So what we have to do is create space. So that's what we're going to talk about today, is creating space right around the medial border of the scapula and also in the shoulder joint in the capsule. So the first thing that we're going to have Casey do, the lacrosse ball. She's going to lie down on her back and she's going to head for a spot that's on the medial side of her scapular border, so on the inside, in between the spine and the scapula. And she's lying down with her knees bent so that her back is flat. She's going to reach that shoulder, so it's her left arm. She's going to go thumb to pocket and then go in a diagonal pattern and think thumb to the floor. So she's reaching her arm at a 45-degree angle, kind of like the Y and YMCA position. She's trying to go as far down to the ground as we can. She's going to continue just working in that movement, and what she's going to do is find different little spots on that medial border as she goes through this for about 2 minutes, okay? As I always say, you really want to just work until you find improvement, but I try to keep it as short as we can. So about 2 minutes on the left shoulder and 2 minutes on the right shoulder, focusing on those spots that are extra tender. And so if she feels an extra tender spot, go ahead and switch. Put it like in a little bit lower position. Just show them how you can do that. She's going to shimmy. She's going to find a new spot. Uh-oh, she found a new... It hurts. Okay, and so if she feels like it's extra tender, she goes across. Usually it's right in that overhead position. 45-degree angle, point the thumb down. She'll just breathe there and see if she can relax. All right, 2-minute prescription. Got the band hooked up to a door. Casey's got the band around her wrist and she's got a good grasp on it. She's going to make sure that her palm is facing up. She's going to take her opposite hand and put it on top of the other. And all she's doing is just creating space in that joint. So we want that joint capsule to get some blood flow to it so that we can start to refresh those tissues with some nutrients. And that's all we're really trying to do. We're not going to look at this as a stretch. Whoop, I'm going to fall. We're just looking at this as opening up the joint capsule. So prescription here, just work in different corners so she can kind of rotate her arm up and down. She can get in and out of positions. And we're going to be here for another 2 minutes on each arm. Pow, boom. Don't muscle it. Right, and the last thing that we're going to have Casey do is the good old half circle shoulder rollover. Ha. All right, so she's going to get her knees to be hip height and a little bit higher, hold them down with the right arm, and we're working on the left. She's going to draw her arm up towards her ear, trying to press her arm as close to the dirty floor as she can, reaching her fingertips away. Good, breathing, staying braced the whole way, and then coming back to the starting position. And when she gets there, flipping her palm down, leaving her elbow high, she's internally rotating her shoulder inward, so we're getting in every position. Go ahead and reach all the way in, all the way in. Help her, Brooke, push it down. Good, and then coming back out. Again, just like anything else, we're hanging out in spots that are feeling extra tight. And we're doing 10 reps on each side. You can see her arm stays pretty close to the ground, which is really hard to do. For people that have a little bit tighter shoulders and actually are working with an impingement, this is going to be a lot harder to do. And what I want you to do is make sure you don't go in a position that's painful. You stop, okay? So self-limiting, stop before any position of pain. Still, 10 reps for every What we're going to do is test out in an overhead position to see if she feels any different. So we're assuming that someone that had an impingement had a little bit of pain reaching overhead. They were extra sore, tight, whatever. And you can see just working on that left shoulder for the couple of minutes that we did that she has a lot more range of motion on the left side than she does on the right. Notice that she's got a good braced spine, neutral spine. It's not hyperextended or super flexed, and she's just flexing from the shoulder. Wow, look at that improvement. All right, good luck on the shoulder impingement work. Say hello.